health alert now as concerns continue to grow about the measles. The CDC now says a total of 910 cases have been confirmed across 24 different states. There have been 5 new outbreaks this year, and the U.S. is seeing cases at a rate that's 5 times higher than the average seen across an entire year. Medical correspondent Dr. Darian Sutton joining me now. All right, let's talk about just the significance of this rise in the number of the outbreaks versus the rise in cases over the past few years, Doc.
Yeah, an important distinction, Kira. An outbreak is defined by 3 or more linked cases as opposed to individual cases that you might see. If you look at a map of the United States, you can think of individual cases as small sparks and outbreaks as small forest fires. And as we see these fires coalesce, that then leads to, unfortunately, increase in ongoing, sustained spread. And the reason why that's important is because if this continues for a year, which we're almost at that point, Kira, this is decided by international organizations, we might lose our elimination status, and that means that as a country we were no longer measles free. And that means increased number of not only cases but complications, hospitalizations, and inevitably deaths that all could have been prevented by increasing participation in vaccines.
And you actually treated measles patients during an outbreak in New York City in 2019, right?
Yeah, absolutely. In 2019, we had our outbreak here. It was approximately 649 cases, Kira. And the reason why I define that number is because that was studied, that outbreak, and it was qualified that cost nearly $8.4 million to rectify. And right now we're looking at an outbreak in South Carolina that's exceeded 900. It's the highest number we've seen in nearly 25 years. And unfortunately, it's a signal that our protective firewalls have broken down. Most of these cases are associated with these outbreaks. Only 6 out of these 900 or so cases that we've seen so far are from international travel. That means, Kira, that the majority of these infections are coming from within our border. And unfortunately, that spells a really difficult course for public health officials who are working hard to try to get people aware, educated, informed, and of course, vaccinated to protect against this infection.
All right, Dr. Darian Sutton, appreciate you. And also, ABC News does have a map to help identify the risk of measles actually in your zip code based on vaccination rates in your area. So you can see the map at abcnews.com/measles and just put your zip code right in there.